Hey everyone, today I have a special guest, Erin Dinnie, and Erin Dinnie is a pediatric physical therapist, and I'm so excited to showcase her business, chat with her, and share a couple of tidbits with you. Erin, would you tell us a little bit about where you serve and what your business is like?
Sure. Thank you, Lauren, for having me. This is a lot of fun. I'm a pediatric physical therapist. I live in sunny Scottsdale, Arizona, and
So
I,
jealous.
yes, I recently launched Moving Together Therapy. It's a in-home physical therapy serving the pediatric population, birth to adolescence. I've just been really having a lot of fun with that. I have a lot of history with treating children of all ages and outpatient pediatrics to in-home to also hospital-based. And just recently I went on my own.
Oh, I'm so excited. When you say you're in the Scottsdale area, do you serve just Scottsdale or are you serving some of those surrounding counties or towns as well?
Right, right. Great question. I am serving, there's area called Phoenix, Arcadia, so North Phoenix, Arcadia. I do see a couple kids in Glendale, which I'll go to, in Peoria. Um, but I mainly want to serve Scottsdale, Paradise Valley, Arcadia, and a little bit of North Phoenix. So those are kind of more of the rural parts of Phoenix. So
Okay, cool.
quite a bit of area though.
Yeah,
So
just
when
a
it's
little a
all,
little
I
bit to
go.
drive.
Yes, yes, yeah, yeah.
And you, like me, which I love this model, it brings so much joy to my heart, but you go to actually like the kiddos' houses with the parents and you do mobile pediatric physical therapy. Would you tell some of the viewers and potential mamas out there who are in the Scottsdale area, like what that is like and what exactly it kind of looks like?
Actually, a couple of years ago when I was working with early intervention and also doing, home health, I had a history of being in the clinic and, doing outpatient therapy with, adults and pediatrics, which I loved. But being in the home really opened my eyes to just like how great it is to be working one-on-one with families. Also being able to see their natural environment, so their surroundings, so I can kind of assess and, kind of help educate families on, well, maybe you want to use this, or if you have stairs in the home, we can practice that way. So using that like natural environment and, utilizing their function to, if a mom is like, I need help to get my child to go up the stairs, we can practice that way. And, they have stairs in the home. Or I need help to have my child walk on different surfaces. We can utilize a strategy of, walking on the grass or walking on the cement in their natural environment. So that's really why I love in-home. Also, I'm able to, guide parents if I see that, oh, maybe, there might be a bouncer in the home and I can kind of, or a jumper, and, that child, that child might, be a little bit, delayed in their gross motor. I can educate them on maybe limit the time that you have that in there, or, not use it at all for a little while. So, whereas in the clinic, I wasn't able to see that. I wasn't able to see, what they
Right.
might have in the home, what the child is doing in the home, because in the clinic, you're only there maybe 1 or 2 times a week for an hour, right? And so I
Hmm.
really feel like working in the home, which I'm sure you feel as well, you get a little bit more of that carryover,
Yeah.
because you as a provider, you can provide a little bit more support to the family to have that carryover throughout the week, if that makes
Do you
sense.
y- Totally. Do you find too where like parents will get like a device or what we for the viewers like a container is really just anything that a baby goes into that holds them in a specific position. So bouncers, even technically a car seat would be considered a container.
Mhm.
Anything where the baby doesn't have free motion to like roll or crawl or kind of get around on their own. Do you
Right.
find that like being in the home, you're able to notice even new devices? Because I know that's something that we would ask in the clinic when a kiddo came for an evaluation, but it wasn't something we were maybe asking throughout the plan of care where like if they have a
Right.
birthday, they might all of a sudden get all of these new things, and
Mhm.
marketing geniuses are great at telling parents that they need all of this stuff, but it's
Right.
not always in that specific child's best interest, especially if they're struggling with some of their movement already.
That's right. Very much true. So, I mean, all of it. I just love being in the home now. It's like my go-to. And also I work with a lot of athletes as well. And so, I've had a couple of athletes where I work in the home, and it's so much better, I feel, because you get that one-on-one. I'm not having to work with 2 or 3 people at a time. And, I've had families, tell me like, it's quiet, we're able to concentrate, and they feel like they're getting a little bit more out of, having that one-on-one time, and getting through the exercises and the, therapeutic interventions a little bit more smoothly, and ultimately will improve quicker.
Is there any specific examples that you have of kiddos who have gotten better quicker, or just things parents have said specifically?
Yeah, well, I would say just recently, which I just felt so great, going out of the home, because a lot of times, and this isn't a blanketed statement. I mean, I love outpatient clinics. There's definitely use for it. Sometimes I refer people out to outpatients. So it's not to say that, but when I was working kind of in those environments, there was high caseloads. So I didn't feel like I had that time to educate the families or educate the child at the end. So it'd just be bam, bam, bam. So I think the biggest thing walking out of a home recently is, I was able to work with a child and, do my thing. But then I was able to show mom hands-on techniques, to perform the activities during the week, and really spend time and say, listen, we need to carry this over because you're only seeing me one time this week. And she just seemed so appreciative and was really into it and was asking questions. And I thought to myself when I left, I was just I really feel like that child's progressing because I'm able to take the time. And it's not, as providers, we want to be able to give that time to families, but sometimes it's just not possible. So
absolutely. I know when I was working in a clinic, and again, I absolutely loved my time in the outpatient clinics, but being in the home and providing physical therapy in the home is just a special experience between the PT and the family. I feel like parents are so much more empowered just based on the environmental cues. They're using their couch, their toys. We might bring a couple things to the session, right, but the parents are using things they already have or that they're really comfortable with. There's less of in motor learning and really the science of the brain. We learn that there is differences between carryover of being able to reproduce a task in different environments. And I feel like parents have so much to focus on that, right, taking something that they were maybe talked about for a couple minutes at the end of a outpatient session, and then be able to produce that confidently in the home versus being with you. A lot of my parents, and I'm sure the same with you, is they're right there. We're chatting the whole time. It might be broken up between baby giggles and weird noises and me singing Twinkle Twinkle Little Star terribly. Right. But they're just absorbing so much more. And then they're producing so much better quality of play with their kiddos. And I mean, I don't know, today I had an entire little family. They were on spring break and we were all doing sit-ups with our feet under the couch. There was 4 kids and me, and we were all did sit-ups without our hands. And to me, that just feels like it just brings the whole family together. And I love that feeling.
Yep, very much. So there's so many aspects, exactly what you described, that you don't necessarily get in an hour when you're in another arena, I would say.
Absolutely. And then if the baby needs to get changed, or they don't have to find the bathroom, and they have all the wipes they need, they don't have to worry about all that extra stuff. So it's really convenient, especially with babies because they sleep a lot.
Yes, yeah, exactly.
Besides just obviously loving and have a huge passion for in-home pediatric physical therapy, and then again you said kind of that also niche of sports-based pediatric therapy. Do you have any other specialties that the people of Scottsdale should know about that is available to them?
I see a variety of diagnoses. You kind of, mentioned a few. So, sports injuries, then children that may present with developmental delay, genetic disorders, plagiocephaly or torticollis, so little babies. I love that because that's just a lot of education, and I love seeing improvement. And then also, children that may have neurological changes and gross motor, difficulties. I just love, and I just recently have been trained. There's definitely different levels of certification for this training, but it's called DMI. Before I move on to that, I've also worked with, I've done TheraSuit intensives and outpatient clinic, which are wonderful, where, a child that may have gross motor delays or neurological changes, they can go and they have treatment for 3 hours a day, 5 days a week for 3 weeks. So that really kind of opened my eyes to really seeing changes quickly, because it's that kind of intense model. So then that's when I was able to find DMI, which is a dynamic movement intervention. It's not really a new technique. It's been around for a while, but it's just recently being shown to other therapists, occupational therapists, physical therapists. It's basically a therapeutic handling technique. It's geared towards children that might have a delay, but I use it with all my kids, mainly max to about 50 pounds, because it is very labor intensive for the therapist.
Yeah, for you specifically.
Yeah, a lot of handling techniques. But it's basically providing a series of exercises. They have hundreds of exercises that you can go through that not just kind of focus on the musculoskeletal system, but all the systems. So your proprioception, your vestibular system, and it's basically giving you that, that the child, that autonomic response for postural control. And the main point is to form neuroplasticity. So if a child has, a brain injury or genetic disorder, it's providing kind of those new pathways in the brain to help with those motor milestones. And I'm learning a lot about it. I love it. I'm going to do some more courses on it because there's hundreds of exercises that you can go through and different equipment that you can use. And it starts basically proximal. So, learning to go through all the milestones to up to walking and, balance and using different equipment to help facilitate kind of that autonomic postural control and strength and balance.
I love it. And if you don't mind, I think this would be a perfect time to go and show everybody your Instagram account, which is super beautiful, by the way. I love your colors. Tons of good educational information on there. We will link everything in the description below so you can check Erin's stuff out. Okay, so this is Erin, guys. It's Moving Together Therapy, and here's her information as well as her website will be linked there. And this is that dynamic movement intervention that she was talking about. You even have I know I'm cute. And I was yes, 100%. Why don't you tell us a little bit about kind of what you're doing here?
So this technique is working on tall kneeling. What's great about this is you kind of work proximally, and then as I'm moving my hand, I'm going more distally. So that means that she has to work harder. That when she kind of did that look ooh, that was hard.
Yeah.
But then she was able to control. So it's working on alignment, postural control, strengthening. She's all happy with herself.
She's so cute.
All things that we work on, but these techniques just kind of help push them along, I think, a little bit faster, and having them control their body a little bit.
Do you find too, with using DMI specifically, kiddos are doing hard things, but they're generally in a pretty enjoyable demeanor? It's hard but doable.
Right.
Is that
social media sometimes, but
the highlight reel in my YouTube videos, I try to show that because it is real life. Babies do cry, and while we try to not go past that, and while we try to calm them down, sometimes it is just real life, and here are all of the tips you could try if a baby is having a hard time. So do you find that they're happier during it, or that it's still difficult and sometimes they still have a hard time and that's just totally normal?
Yeah, yeah. Oh, that's totally normal. And you will find, so there are a lot of DMI therapists that just do like intensive. So the things that you'll kind of see those videos online where they're seeing the child like the first week, and then you see the changes at the end. In the
Mm-hmm.
beginning, the child may be like, oh, this is really, really hard. This is difficult. But by the time you see them, when they get used to, some of these exercises, then it's like, oh, this is a piece of cake. So, it is challenging, for the child. I'm not gonna lie, but it's also work,
Yes.
and then as they get stronger, it becomes easier. But just like any other activity that we do, we gauge a child's cues if it's too much for them, and or modify, an activity. Yeah, it's all the same concepts. There just might be a little bit different handling, and the reasoning why. It just may be a little bit different. So that's what we learn. And I mean, like I said, there's still so many more activities I could learn, but it's just another tool in the toolbox. To the ultimate goal is get them moving, and find out the family's goal on what they want to achieve.
Absolutely. And just for everybody out there, too, one of the big reasons why physical therapists and occupational therapists as well always talk about that proximal stability, or really just like core control, but even more than core control, it's, the whole cylinder body, where it's like head and neck control, trunk control, front, both sides, back, pelvis, glutes, kind of everything basically but your arms and your legs. Those would be considered like your limbs. You need that proximal stability before you can have what we call distal mobility, which is basically anything you want to do with those limbs: kick, stand, walk, write with a pencil, type on a keyboard, eat. All of these really important things, we need good core stability, and we also need really good alignment, and that also helps with breathing and pelvic floor things and potty training, and like just having a good solid foundation from which to like build your motor life on. And so I love that DMI is becoming more out there, in the forefront. I know that there's a few therapeutic concepts. I know I was just trained in total motion release for kiddos, and me and Erin have talked about that. And then Erin is trained in DMI, which I am not trained in, but find super fascinating. Is like, there are therapists out there that are getting these additional certifications and trainings because we want to help your kiddos progress, and we want the experience to be as easy as possible on you as the family and on your child during their experience, so that they can move optimally, whatever that looks like for them. And I think having really ambitious physical therapists, especially pediatric physical therapists, that are also in this alternative healthcare model of mobile pediatric physical therapy, or even, we can talk about it in a second, like cash-based pediatric physical therapy, is it allows some of these families who maybe weren't seeing the gains that they wanted to see a little bit of hope that, like, hey, there are different things that I can try. Like,
Mm-hmm.
There are other options out there, and I can try different things, and I can learn these different things, and maybe they will help my kiddo.
Yep. I love you,
Awesome.
Laura. That's perfect.
So let's chat a little bit about like your website. So say there's someone in Scottsdale, and they're like, they have a kiddo and they're sitting at their computer.
Yes.
They're like, I cannot leave my house because I have 2 kids. Wouldn't it be awesome if this really amazing human could just come to my house while I quietly drink my coffee and just watch her like work with my kiddo, and she just like tells me all the things that I need to know on how to help my kiddo move better? How do these people find you? where would they go?
My name of my company is Moving Together Therapy, but the website is www.movingtogethertherapy.com. And Lauren has graciously put it up for you guys to see. And you can just kind of go through there and, you know, look at all the information that I have to share. And then on that side as well, you'll see like bookings and services. And then on the bottom of my page too, on each of the pages, you'll find my information and phone number. And on the last page, if say you want to send me like a submission, like, you know, these are the days and times that I prefer, and you can put your information in and I will give you a call back within 24 hours to talk with you. Also, I do have free consultations. So, you know, if you really just want to call and find out a little bit more, find out a little bit more about my services, I'm happy to talk to you and provide any information that I can for you.
Awesome. And then, so if I just clicked this like book online button, it takes me to, oh, okay, cool. So then it tells me what your services are. Now, I will say, everyone, that these are prices at the time of recording. And because Erin is so amazing, she does reserve the right to change prices and things like that. So if it isn't exactly what it is on this recording, definitely check with her. Erin is amazing though, and I love that she has a high value on price transparency. That's something that's really important to me, because I think in healthcare it's something that's really needed that we don't see that often.
Yes, yeah. And so I am kind of what you touched on, Pawn. I am cash-based practice, but for the families that do want to request a super bill, I do provide that to the families. And I also, in the state of Arizona, I think you can see here, I'm also ESA, the Empowerment Scholarship, and Class Wallet approved. So if there's anybody out there, you know, in the area and you're seeing this, and you have the ESA scholarship, I'm a vendor for them as well. So you should be covered that way. But if you have any questions, feel free to call and ask about that. But again, if you have any questions on the services that I provide, and then on the top you'll see the request appointment, which you can you know, fill out, and I'll be happy to call you just in case if I'm with a patient or something and I don't answer.
Okay, cool. So then they would just fill this out, and then you confirm that appointment with them. Okay, and then I see that there with like preferred days and times, and then their address, because again, you go to them.
Correct. Yes.
Perfect. Well, I love this. So something that I do love to chat about, and Erin, feel free if you would prefer people to talk about this with you. I know I don't think we chat about this before hitting record, but I know sometimes money can be weird for people. One of the biggest questions I get is like, well, how do I pay you? Do I just pay you in a check after each one? Like if I wanted to, like say I'm not ESA or Class Wallet approved, say I just want to pay you each time you come see my kiddo. How does that work right now?
Right. So I take cash, credit card, HSA, FSA. I have a couple of families I do HSA. And then I provide you, when you're signed up, I provide you with all that paperwork and get all that information after we've chatted and you've decided that you'd like to proceed. So it's pretty simple and straightforward. Check, I don't know if I said check as well, but those are the payment options. And I also feel like I have that on the section where it has facts and questions.
Oh, you do. You know, I did. Yep, up here, guys. I love having an FAQ. Like, just give me all the stuff in one place. Erin is super organized, so she's got you covered there.
Yes.
Awesome. Well, I'm excited. I don't have any kiddos, and I am not in Arizona, but if I was, man, I'd be like, I'm all set. I'm all ready to sign up. Your website is super cute, by the way.
Thank you, Lauren.
You are
You're
so
always so supportive.
welcome.
I appreciate it.
Okay, and then the last thing that we haven't gone over yet is you do have a Facebook page as well, right?
Yes, yeah.
Okay, so let's talk a little bit about the
And those
Facebook page.
and those items, you'll see kind of the similar items that were on my Instagram or on my Facebook. It's just, some people use Facebook and some people use Instagram, or
Totally.
so but similar information. So I always post on both, and you can feel free to message me. I've gotten handful of messages through Facebook as well. So if that's your forum that you like to message through, so I have a few forums that you can contact me on, and it's Moving Together Therapy PLLC book page.
Awesome. Do you have like 30 notifications like I do when I just don't go on Facebook or listen?
Facebook, I know. Yeah, I have to remember. I'm not used to it. Okay, check your.
Am I the only one who does that?
Yes.
Is there anything else you want to tell all those mamas in Scottsdale who are like, I just want to be heard. I have questions on how my kiddo moves. Like, I don't really know who to go to or what even to ask me.
So, I mean, definitely if you feel like, you have some questions, you can always go to your pediatrician. Arizona is a direct access state. So once you come to me and we get going, I always like to keep that communication because I love team-based and making sure that we're, all staying communicated with, whether nutrition, speech therapist, OT. I like that kind of teamwork, that we're all on the same page. But if you have any questions, you can feel free to reach out to me. You don't necessarily have to go to your doctor. Or if there's something that, you have some questions about with your doctor, you can say, hey, do you think maybe PT would be a good start, or that would be something that we could try? And I have Erin in mind, but again, you don't have to get a referral necessarily to be seen. State of Arizona. So that's one thing that I wanted to make sure that you have access, and if you have a feeling that PT may benefit your child, I don't think it ever hurts. Like, I'm always about, and I know you are as well, is earlier the better. Sometimes there's a lot of that wait and see approach, or Johnny hurt his ankle and it's like blown up, let's just wait. So I'm all about, let's just get things going as soon as possible, and empowering the families continue with their home exercise, because ultimately my job is to get you better, or to get to the goals that you're trying to achieve for your child.
Well, and you also have those introductory phone calls too, so parents could just like schedule a phone call with you if they had any questions, or even honestly just wanted to pick your brain, like, hey, is this something physical therapists help with, or should I call or is there a different like expert that I should be talking to that might be able to answer this question?
Yep, for sure.
One of like the big reasons why I'm like interviewing you and all our awesome other like pediatric physical therapy friends is that truthfully, I feel like we are in like our little clinics and we are trying to break out and we're trying to educate parents, but we're also super busy. And so parents don't always know, like, hey, there are people out there that can answer this question, can get you where you need to go. And oftentimes it's a lot less stressful than it feels like when you don't know what you don't know and you're mostly just worrying about it, right?
Got it. That's correct. Yeah. So
awesome.
I'm really looking forward to meeting new families, and just want to say thank you for giving me this opportunity.
Well, I had an absolute blast, and you guys, we will have to get Erin back on because she's been super fun, and I know that she could teach us a ton more stuff about her experience with DMI therapy. And then also I'd love to keep the conversation open about sports physical therapy with the pediatric population. Awesome. Well, if you guys are in Scottsdale or the surrounding areas, definitely look up Erin and make sure that you reach out to her with any questions. Erin, anything else you want to add?
Thank you. Thank you again for having me.